Hello, thank you. Thank you for the opportunity. My name is Nasreen Nakib. I'm from the University of Minnesota. I have no disclosures. I'm here to speak to you about the Pelvital Flight System. This is a two-part mechanotherapy. Part one being the pelvic floor training that preconditioning via a probe alone. And the part two has mechanical transduction phase, pulses. This, in turn, is supposed to create maybe an enhanced form of pelvic floor muscle training, where you are augmenting the muscle cell anatomy as well as the neurotropic signaling. So we had 120 women at 3 different sites. Our inclusion was patients 18 to 75. They could only have stress urinary incontinence, so we excluded the urge urinary incontinence patients. We excluded anybody with over stage 2 prolapse. They had to have a minimum of 10 grams of leakage at baseline and, of course, the ability to contract their pelvic floor muscles. The objective was to demonstrate that this system, this device, with and without the mechanical pulses, will actually improve urinary stress incontinence. So this was a randomized, controlled, double-blinded study with crossover, where the patients were randomized to either the probe alone, which was part one, or the probe with the mechanical pulsations. And our part one arm acted as the control. However, after 6 weeks, they were crossed over into the arm with the pulsations as well. At the moment, the study remains blinded because we only have preliminary data. But patients performed exercises for 5 minutes a day, so it was very feasible, and it was, again, for 12 weeks. We did 24-hour pad test measurements, voiding frequency, quality of life at baseline, 6 weeks and 12 weeks. And then there will be some long-term follow-up at 6, 12, and 18 and 24 months via telephone and questionnaires. We have 82 subjects. All showed significant decreases in mean and median pad weights at 6 and 12 weeks. In fact, there was a 59% relative improvement at 6 weeks and then a further improvement to 68% at 12. And interestingly enough, that women with all levels of severity had improvements. Furthermore, there was significant subjective decreases in the number of leakage over the 30-day period from 53.8 to 25.8. Our 3-day diary data is still pending. They also had improvement in quality of life at 6 weeks and 12 weeks. So here's the pad weight reduction at baseline. You can see at the 6 week, you show even the median and the mean both show reduction, significant reduction, and then this further increases at 12 weeks. And then there's also a reduction again in the from a subjective standpoint, so that tells you it's clinically relevant, because there's so many times where patients may say, well, you know, I didn't run that day or I didn't exercise that day, but they're really noticing a difference here, and it's not just the pad weights. So in summary, we feel that the flight mechanotherapy for enhanced pelvic floor muscle training showed improved multiple clinical indices. These improvements were sustained for long-term follow-up. We did have, interestingly, about 20% of subjects that did not respond, and we do need to study these patient characteristics and the mechanism for why this is the case. But in conclusion, we feel that the two-part therapy provided by the flight system appears to be an effective, non-invasive treatment that is very feasible for women treatment with stress incontinence.
Thank you. So we have time for a few questions.
Hi, Jeroen from the Netherlands. Technical question. What are mechanical transduction pulses?
Pulsations. Yeah, so the probe actually has this kind of oscillations where they're vibrate. I don't want to call it a vibration, but it's an impulse that is kind of triggering as you're doing the contraction.
Okay, and second question is, how did you assess adherence?
Actually, the device itself can tell us whether the patients were doing the exercises.
And you mean that you can see that it's turned on and off, or that they actually...
That they're actually doing the contractions and how strong the contractions.
Okay, thank you.
Thank you for your presentation. I was wondering about your conclusion, because you're actually reporting data before and after within a randomized controlled trial. This is not a difference between the two groups.
Say that again, I'm sorry. I'm
Yeah, you're
understanding.
not reporting the difference between the two groups.
No, we're not. We're
No.
not. We're just saying, in fact, across the board, we're seeing improvement.
Yes.
So we're not reporting the data across the two groups just yet.
So I think the conclusion is not correct, according to that we have not used a randomized control design.
Well, we're saying here that the two parts, whether it's the with or without vibration, the probe itself sometimes, where we postulate, is actually activating some of the motor neurons, and the neuroplasticity that's there is actually helping with the...
But that's another question, and we need data for that. So to conclude, you have to use the design of the randomized controlled trial, which is to compare the difference in change between the two groups. That's the only way to see if this is working or not.
I don't know. I don't think that we're not really specifically saying that the actual pulsations are working. We're saying that this device, with or without the pulsations, is helping patients.
Yes. The conclusion relates to an RCT outcome, not a pre-post observational.
Okay, I hear what you're saying. Yeah.
One last question.
Hello, Emma Nyström from Sweden. Thank you for a nice presentation. Maybe it's just me not understanding, but would this part one you're talking about, is that then just measuring? Would it be comparable to normal pelvic floor muscle training, or are you comparing two active uses of the device?
Yeah, I mean, the reason we didn't have like another control group that wasn't using the device was because obviously it couldn't be blinded. So we feel that having the probe in the vagina and giving some sort of feedback to the patient in and of itself is making a difference.
But you have no comparison with just an ordinary pelvic floor muscle training?
Well, we compare, I mean, there's lots of data in the literature to show us that. So we didn't feel like we wanted to repeat that.
Thank you.
Very brief question with a very brief answer.
Thank you. Sarah Dean from Exeter. I'm just interested in who was blinded, because I wondered if they were feeling the pulse, then they would know.
No, so everybody was blinded. We randomized the patient. The patients did not know which device they had. They didn't know whether it was supposed to pulse or not pulse, so we didn't give them that information. We just said that you could do these exercises around a device, and that was it.
Okay, thank you.
Mm-hmm. Yeah, thank you.
We'd like to bring